Oh, look, it's such a great pleasure to be part of your inaugural Sickle Cell conference today. It's a wonderful, wonderful achievement that you've managed to pull this together. I'm sure all of us wish that we were together in person, but such is life in the middle of a pandemic. I want to thank you, Marguerite and Agnes, for the work that you're doing in this really important area. And also acknowledge the work of my friend and colleague, Maria van Vakenu, who has been a strong advocate of sickle cell disease issues and working with your organisation, I know as well. I'm not sure whether he's been able to do this, but I understand Greg Hunt, the Minister for Health and Ageing, was hoping to send your conference a message. I hope that he does that. And I want to pay tribute to the work he's been doing as Australia's Minister for Health during this incredibly difficult period. Obviously, I'm a member of the Labor Party and I wish that the Labor Party were in government. But when I look across the aisle in the Australian Parliament, there is no other member from the coalition I would prefer to have as Australia's Minister for Health than Greg. He's worked very, very hard. He's experienced. He's intelligent. We don't always agree on everything, and such is the nature of a vibrant democracy. But I want to pay tribute to his work, and I'm glad that both the Minister and the Shadow Minister are able to present to your conference so that we can demonstrate our shared commitment as the two major parties of government to doing better in so many areas of our health system. I do want to say, though, while I want to talk a bit about the challenges that we face here in Australia and that your organisation is drawing attention to, that at a time of global pandemic, it is really worth reflecting on some of the achievements of this country. And two of the crowning achievements of Australia in the post-war era, so over the last 70 or 75 years, I think, are firstly the quality of our health system. This is a great Labor legacy, I have to say, in many ways. One of the world's best medicine system, the Pharmaceutical Benefits Scheme, was introduced in the couple of years after World War II by the Chifley government. The Medicare system was something that we, the Labor Party, fought for many, many years. And I'm glad to say I think now is permanently settled as part of Australia's social fabric. And we have a great public hospital system where every person in this country can go and receive world-class treatment for free. And there are many, many developed countries where people are not able to have that as a right. There are issues with our hospital system. There are issues with Medicare. But I think in a time of global pandemic, we really are reminded just how proud we can be of our public health system and everyone who works within it, whether as a clinician or, in your case, as an advocate for better quality care. The second crowning achievement, I think, and this is broadly accepted across the country, is that Australia has really settled its place, I think, as the most successful multicultural nation on the face of the planet. Millions of people have taken the often very painful decision over the last 75 years to leave their home, to cross the oceans and to build a new life for them and their family here in Australia, literally millions of people. We know that there are more people who are either born overseas or who have a parent, at least one parent born overseas, than really any other developed nation you can care to point your finger at. And we have made such a success of that multiculturalism. We are a proudly multicultural nation. The challenge sometimes is to blend those two crowning achievements together, because we know for all the achievements of our public health system, the delivery of quality healthcare is not always equitable across our country. It can be very different between the major cities and rural and regional Australia. It is very different often in different socioeconomic groups. The further you go from the centre of a major city, the less likely you are to be able to find many different areas of healthcare, particularly in the specialties, mental health, many others besides. So a more equitable delivery of healthcare is a constant challenge, which we must always be alive to. But there are often differences as well across different cultural groups. I know when I was the Minister for Ageing 10 years ago, introducing a culturally and linguistically diverse strategy for ageing and for the delivery of aged care was seen by groups like the like FECA, the Federation of Ethnic Communities Councils of Australia, and a number of other multicultural groups, is critically important, because the type of aged care that different cultural groups expect and rightly demand can differ across the country. So blending those two things is a constant challenge as well. And it's not just the delivery of healthcare that needs to take account of different cultural and linguistic groups within the community, but it's also the fact that there are different disease profiles between different ethnic groups. We know, for example, that for multiple sclerosis, the further away you are from the equator, the further away you were born from the equator, the more likely you are to have MS. So it is a disease that afflicts Anglo-Celtic people more than people who grew up nearer the equator. And sickle cell disease is equally something that is not typical among Anglo-Celtic groups, but is becoming more prevalent because of the nature of our proudly multicultural society. And that is something that we as public policy leaders, Greg Hunt, myself, people in the departments, people at state government level, must continue to have an eye on. There is obviously the broader challenge of rare diseases, which is a bit of a misnomer, because there's nothing rare about rare diseases as a group at all. As many as maybe 2 million Australians have a disease that we class as rare when considered in and of itself. My understanding is we don't actually know how many Australians have sickle cell disease. And when you don't know the prevalence of a disease, when you don't understand its scope and its scale, you are vastly limited in your ability to respond to it, to treat it, to understand it. You must have the data. And I know that that's a critical core objective of your organisation, and I'm sure something that you intend to talk about quite a bit through the course of this conference. I know particularly that one of your core ambitions is the expansion of the hemoglobinopathy registry that's based at Monash University. I'm very keen, particularly as we lead into the next 12 months, to talk to you further about that particular ambition. But more broadly, beyond just sickle cell disease, there are endemic challenges generally in how we respond to rare diseases. There is, as you've pointed out in all of your documentation, the ongoing challenge of awareness about a disease that is not common broadly across the Australian population. Awareness among patients who might have it, but also among clinicians who are dealing with so many different challenges and such fast advancing knowledge about healthcare. Lifting that awareness, ensuring that people receive a timely diagnosis, a quick, accurate diagnosis so they can access all possible available treatments, is something we have to be very, very conscious of. And one of the real challenges, I think, in all rare diseases, and you've pointed it out, is the ability to access innovation. We live in what I think is a turbocharged period of discovery because of the advent of big data, of genomics, of proteomics, and so many other wonderful innovations that are giving us access to healthcare and to treatments that only 10, 20, 30 years ago would have been unthinkable. We must ensure that those innovations are available to all disease types. And I know particularly being able to access phase 3 clinical trials for sickle cell disease and other rare diseases is an endemic challenge. We must do better at that. Now, I'm very conscious that the government has acted in the area of rare diseases. The action plan, the strategic action plan on rare diseases, is something that has bipartisan support. Some of the MRFF rounds also have been focused on dealing with some of those, or trying to respond at least to some of those endemic challenges in rare diseases, including around clinical trials activity. Again, that has the support of the opposition as well. But while I applaud what the government has done in those areas, there is always more to do. And I know that you will be seeking to discuss that at your conference, and you will understandably be seeking to push the envelope in what the two parties of the government are thinking about and developing as potential policies in this area. And I say your advocacy is just so important. Your insights, your expertise in this disease area is just so important to the development of good public policy. your lived experience, the lived experience of those you represent, is just so important, and reminds us that the patient experience and the patient insights must be right at the centre of public policy development in all that we do in the healthcare system. So thank you very much. I'm just absolutely delighted to have been invited to your inaugural conference. It's a great privilege. I recognise it as such. I wish you all the best for the rest of your conference, and I really look forward to continuing to have a relationship with your organisation into the future. Thank you, Marguerite.
Thank you so much, Mark Butler, the Shadow Minister for Health and Ageing. Greatly appreciate your message and your acknowledgement of the bipartisan support. So that does align with Minister Hunt's message earlier in the conference. So thank you very much. I really appreciate too that you also mentioned the cultural diversity of Australia and the difference between socioeconomic groups. That is something that impacts this particular community dramatically. And so thank you very much for acknowledging that. We look forward to working with you more in the future. Thank you. Thanks for your time.
Thank you. All the best for your conference.
Thank you. Take care.